Abilene is a friendly West Texas town. We're kind of a hub for a lot of rural areas around us. We're big enough to have shopping and stores, but not too big to have really bad traffic and big city issues. Betty Hardwick Center is the local mental health authority in our community. For many years, we've had a crisis response for behavioral health calls. But what was often happening before is that each agency was responding individually. If a call came to 911, the police department would respond first, arrive on scene, and then if they needed mental health services, they would call a mental health worker. And sometimes those things would take time.
That was the main complaint on the PD side. We would get these crisis calls. Officers would get tied up for hours with a mental health patient instead of answering burglary calls and things of that nature that were more law enforcement specific. So how could we facilitate that better and have a more tailor-made response that would help the people that were in crisis? The community response team is a multidisciplinary team that was brought together with PD, fire department, and our Betty Hardwick Center.
The teams are made up of an Abilene Police Department officer, an Abilene Fire Department paramedic, and a Betty Hardwick Center mental health crisis worker. They respond to calls from 911, and they're able to do safety and security on the scene, mental health assessments, and also medical screening.
Initially, they were going to call it the CRT, the Crisis Response Team, but then we got to thinking, like, we don't want to just respond to crisis. We called it the Community Response Team so we can engage with people in the community, do a lot of proactive work, and not just have people think that they can only call when they're in a crisis.
That's Margie calling back. Hi, Margie.
Hey, where are you guys at in town?
You want us to come see you?
I'd love to see you guys.
I don't see her.
Is this her sitting down there? Yeah, there she is.
Yeah.
Hi, Margie. How are you?
Hey, I'm great.
Good to see you.
There you go. Well, you look happy.
Yeah.
Your spirits are back.
Yeah, yeah. Life is good. I have anxiety because I lost my son, and I was crying and in a meltdown, and they showed up at my house, thank God. They helped me. They got me into some outpatient counseling, and they've checked up on me regularly just to make sure things were going good. They just don't see and forget about you. They're constantly involved.
The trust that we have built has been built by just seeing people over and over again, kind of breaking down the barriers of people having bad memories or bad experiences with, police department or fire department or Betty Hardwick, that changes their mind on things and maybe changes what they say to other people.
Everybody's aware that police encounters with people in mental crisis usually don't end well for either side. But this is not a law enforcement encounter. It's truly an encounter for their well-being.
I love you guys.
Take care of yourself.
I will.
We're thinking about you today.
Thank you.
Bye.
Bye.
Good day.
I will.
Enjoy your cake.
I will.
The people that we're going to go see are just as human as you and I. Just because they're in that situation doesn't make them any less human or any less deserving of dignity than anyone else.
I come out this way so the vicious dogs don't attack you. Hey, Grant.
Grant is an individual we've seen, for, I want to say, at least 2 years now.
I like your shirt today.
Yes, choose wisely.
He definitely has his ups and downs.
I kind of struggle in the living department, which is what they come here to help me with.
Did you call us at all last week?
Yes, I didn't.
People would often call in on him because he would be in the street or threatening suicide.
Before, when he would go into crisis, we would have the police respond. He may be hospitalized.
I'm very thankful for them because I was at the point I didn't know what to do for him. He'd run out and try in the street and in front of cars, and I didn't know what to do.
No, everything was locked down.
Yeah.
Kind of made a joke.
They were able to talk to him on his level and make him understand that people would actually miss him if he was to succeed.
If I'm in an emergency, I know I can call the community response team phone number, and I have used that before.
Our goal is to keep these people out of the ERs and keep them out of jail. So if they call the crisis line and they're suicidal and they need help, we can get there immediately and be able to start that process and figure out, where's the missing piece of the puzzle and what can we do to help.
All right. Well, good to see you, Grant. You take care of yourself.
That's what I'm doing.
It's just the circle of care, seeing them do well, seeing them get the new job that they wanted, or even just getting to talk to their parents again because they're stable enough. It's a huge reward that we don't often get to see in our line of work.
I feel like today people talk about mental health a little more openly than they did before. And I also think that approaches like this not only respond more appropriately to people in the field, but it also helps educate a lot of different stakeholders about the kind of work that we're able to do together to help people achieve recovery.
Like, these people have rights too.
We said there's a need and we need to do something, and we just stepped up and did it. It really seems to have a calming effect on the consumers, and it is an absolute gem for us here in Abilene.
I see your clinic appointment.
Oh, yeah.
December 5th. That's good.
People are more willing to reach out for services. They know that on any given day, all they have to do is pick up the phone, and they've got 3 friends that are going to come see them.
Being born and raised here in Abilene, it brings me great pride knowing that what we're doing here is being noticed across the nation. I wanted to be a police officer because I wanted to help somebody. Being on CRT, I get to help people, and I get to see what I've done and the impact that I've made and the change that you can make in someone.
I think it would be a great asset for any city to have. It's just something that we can do to help each other out, What's a little bit of help every now and then? Somebody stopping by and saying hi. It's just builds your spirits, and it helps everybody in the long run.